So first, it prevents progression of curves and improves structural alignment, reduces pain, improves appearance, and improves cardiopulmonary function. So the only type of scoliosis that is typically and frequently managed in spinal orthosis is the idiopathic curve. So there is often a primary curve, the curve with abnormal growth, and a compensatory curve, which is a second region of the spine curving in the opposite direction of the primary curve to keep the head centered over the pelvis. So dyan papasok yung mga S, yung C. So the age of the child, growth remaining in curve pattern, all have implications for prognosis. So kung lahat kayo may POC, kapag sa spine area kayo napunta,
siguro naman ano?
oo, 10 na, sakto na yun. Tigdadalwa na kayo.
Sana 10.
So pag sa spinal area, meron doon na sa spinal area na for scoliosis. Kaso babae lang. So doon tinuturuan kung paano yung patients. Babae lang po yung sa scolio. Kasi puro babae po. So doon, mga tinuturo, ang ginagamit nila doon is yung Schroff na technique.
May ituturo nila.
Yes. Tapos may iba doon mga naka-orthosis talaga pag dumarating. So, ang relative contraindications for orthosis, congenital defects of vertebral formation or segmentation, inflexible curves, or anesthetic skin over iliac crests or other pressure areas. So, indications, the orthosis is indicated in patients with an immature skeleton and documented progression of orthoracolumbar idiopathic scoliosis that measures 25 to 35 degrees and has an apex of T7 or lower. So meaning that orthosis is parang required for patients with moderate scoliosis. So contraindicated na siya if the patient's curves are more than 40 degrees, so which is already the severe type of scoliosis, and who are skeletally immature or have curves in excess of 50 degrees after the end of growth. So both of these types of patients are typically candidates for surgery. So for wearing scoliosis orthosis, so 23 hours each day for favorable results, or wear only at night when effects of gravity are minimized. So una natin is the Milwaukee. So ito yon, the Milwaukee. Ito si Milwaukee. So, posteriorly opening orthosis used to control or correct spinal curvature up to 40 to 45 degrees with apices above T6. It is bulky and less cosmetic, and it is considered one of the oldest type of orthosis. So, we have the basic parts. So, first we have the pelvic girdle. Ito yung pelvic girdle. So mamaya may picture naman tayo dito. We have the head and neck unit. So may occipital pad. So mamaya tingnan lang natin yung picture. Ayan yung picture. Pakahirap ako. So we have one anterior upright. So ito, one anterior
actually,
upright.
Actually, ito mga picture niya na. Pati yung mga parts niya, papa-identify ko next week pala. So, next week.
So ito yung anterior upright. Posterior uprights, meron tayong corrective pads. We have the outrigger, thoracic pad and strap, lumbar pad, axillary sling and straps, shoulder ring and straps, and then the kyphos pad.
Kunyari.
Kung makita yung picture, wait lang zoom natin ang konti. Hindi talaga siya kita pa. So ito yung Milwaukee. So mamaya discuss natin yung parts. So next we have the Miami orthosis. So kung si Milwaukee is for apices above T6, for Miami orthosis naman, it is for apices below T6. So meaning T7, below T6. So it is custom molded. Posterior opening plastic shell which encompasses the pelvis and thorax to reduce and prevent progression of lumbar, thoracolumbar, and thoracic curves. It cannot be converted into a CTLSO or a cervical thoracic lumbosacral orthosis. So for the design features, minimal coverage of anterior and lateral aspects of the thorax, so as to permit maximal spinal rotation, reduce impairment of pulmonary function, and prevent possible interference with breast development. So it includes a lumbar and thoracic pad. So yan, makikita nyo, hindi niya ini-impede ang paglaki ng dede. Kung may ilalaki pa ang dede niya. So para saan nga ang Milwaukee for above T6, si Miami
kasi CTLSO siya eh. Siya lang ang CTLSO,
si Milwaukee.
Cervical down to sacral siya.
Kaya sabi din dito about kay Miami, hindi siya pwedeng i-convert into CTLSO. So next we have the Boston orthosis. Ito naman for below T8. Ito can be converted naman into a CTLSO. It is a posterior opening plastic module which encompasses the pelvis and thorax. Prefabricated. So reaction points na design features, symmetry, reaction points to affect considerable reduction of lumbar lordosis, concavity over the abdomen to increase intracavitary pressure, assists in reducing lumbar lordosis, soft foam rolls which fit over the iliac crest. So it includes a lumbar pad, thoracic pad, trochanter pads, and rotation pad. So ito yung itsura ni Boston orthosis. So next we have the Wilmington. So si Wilmington is custom molded anterior opening total contact plastic body jacket which encompasses the pelvis and thorax. So it is used for curves with apices below T8 and it cannot be converted into a CTLSO. So ano pa nga yung isang orthosis na hindi pwedeng i-convert into CTLSO? Miami. Very good, Danison. So for the design features, in the fitting and fabrication process daw, scoliotic curves are first reduced on a risser table by application of strong destruction and lateral corrective forces. A plaster wrap is applied while the patient is subjected to these forces so that the resulting positive plaster model represents the trunk with the curve significantly reduced. So Wilmington is molded over the model to maintain the correction achieved. So no pads are used. So ito yon. Yan. Tapos lalagyan ng plaster wrap kung saan yung i-correct. Diba may gagamitin daw na force. Tapos saka lalagay yung Wilmington orthosis. So prefabricated siya to fit exactly the model. Yan. So next we have the Nyoho. Ito yung nakabi natin Nyoho. Yung New York Orthopedic Hospital orthosis.
Ikaw lang
ako lang ba nagtawag ng Nyoho, ma'am? Sa batch ka pala natin yung Nyoho.
Sa inyo na
Nyoho. Hotdog favorite mo si Nyoho. So it is custom molded, an anterior opening in plastic pelvis and thoracic shell to reduce and prevent progressive na progression ng lumbar, thoracolumbar, and thoracic curves. It is used to treat high curves without recourse to Milwaukee superstructure. So it can also be converted into a CTLSO. So dalawa lang yung hindi nako-convert to CTLSO out of the 5. So we have the Miami and the Wilmington. Tandaan nyo yun. Ayan, lumabas sa post-test. So for the design features, it has reaction points to maintain reduced lumbar lordosis, concavity over the abdomen to increase intracavitary pressure, assists in reducing lumbar lordosis, windows or openings on the side opposite the pressure pads to allow for migration of vertebrae, and minimal chest restriction and adequate ventilation. The adjustability of the thoracic aspect to accommodate growth. So it includes the lumbar pad, thoracic pad, and trochanter pads. So ito yun. Yan, si Nyoho. Yan yung New York Orthopedic Hospital orthosis. So, hindi naman sinabi dito kung para saan siya. Kasi dun sa iba, di ba, nakalagay kung below T8, above T8. So,
Ano lang siya,
high curves. So, for orthotic maintenance, to obtain the best service from orthosis, the patient should observe basic routine inspection and care procedures. Okay. Pengi akong flash drive kasi masyadong malaking file to. Ma'am, yung sinend ko sa inyo nung Sunday na PowerPoint, hindi ganito kakomplete.
Kaya nga, bilhin mo ako.
Apo.
Sige, kukunin na lang kay Nina.
Apo.
Pati yung isa.
Alin to?
Yung isa kanina mo.
Apo, magkasama po yung sa akin. AY.
Okay, mga kapatid, i-picture nyo na yun, ha? Oo. Na-identify na ba yung parts?
Apo, ito
Ayun,
na lang po sa
picture
Milwaukee.
na. So, next week, no, after the Holy Week, check up the pieces.
Yoho.